Hello and welcome to the Health Talk episode by Yashoda Hospitals. Do you have persistent fever, swollen glands, joint pain, joint swelling or digestive problems? There is a possibility that you could be suffering from autoimmune condition. I'm Dr. Lakshmi and joining us today we have with us Dr. Keerthi Talari, consultant rheumatologist from Yashoda Hospitals, Secunderabad, who will be discussing about what exactly do we mean by autoimmune condition, what are the risk factors, and more importantly, what are the preventive measures and treatment options. Welcome, doctor.
Hi, I'm Dr. Keerthi Talari Bommakanti, consultant rheumatologist at Yashoda Hospitals, Secunderabad.
So, doctor, I'm sure we are all familiar with the terms like bacterial or viral, that is infective, or trauma. So, what exactly do we mean when we say it's autoimmune condition?
So, as the name indicates, auto means self and immune means immunity. So, human body normally has a defense mechanism or a protective mechanism which protects our body from infections from outside. So, this is what we call as immunity, or in normal terms we call it our resistance power. So, mostly our white blood cells are responsible for this immunity or resistance power, and normally immunity should help us. But in people who have autoimmune diseases or in autoimmunity, what happens is our own immunity starts attacking our own self. So, even without any infection within the body, even without any problem within the body, the immunity starts reacting against ourself and starts attacking various parts of the body.
So, it's something like our own body is treating our own body as a foreign body and it's attacking?
Yeah, exactly.
But isn't that scary?
Autoimmune diseases can at times be life threatening too when they affect multiple organs, but some autoimmune diseases would be just restricted to a single organ. So, that time that would not be a life threatening situation, but once it starts attacking multiple organs of the body, yes, at times it could be life threatening too.
So, generally what are the causes for autoimmune conditions, doctor?
It is considered to be multifactorial, that is genes, environment, certain infections and several other reasons play a role in an autoimmune disease. So, it is believed that a person's genetic makeup is responsible for the kind of immunity they develop, and the immunity can get modified according to the environment they are exposed to. Environment not just means external environment, it also means the kind of mental stress, the physical stress that they are going through. And certain times, certain infections like post-infection, it could trigger an autoimmune reaction within the body. So, all of these together like genes, environmental factors, their lifestyle, their stress levels, the kind of medications that they are using, and also certain infections can trigger autoimmunity.
Yeah, doctor, but I believe women are more prone to autoimmune conditions. Why do you think so?
Most of the autoimmune diseases are common in women, primarily because it is believed that the hormonal imbalances that a woman has, especially the estrogen levels, excess of estrogen levels, can trigger an autoimmune disease. So, in fact, we see that most of the times autoimmune diseases are more common during the reproductive age group or post pregnancy, or in the perimenopausal age group. Autoimmune disease onset is usually noted. It's also believed that the X chromosome that a woman has leads to increase in the number of autoimmune risk genes, and that is why they develop autoimmunity.
What are the various autoimmune conditions, especially in our country, that you encounter?
So, as a rheumatologist, we get to see predominantly diseases which affect multiple systems. Autoimmune diseases can occur in any organ. For example, psoriasis. Psoriasis is a skin condition which is usually dealt by dermatologists. But people who have psoriasis can develop psoriatic arthritis too. So, the autoimmunity is spreading to the other organ, which is joints. So, once that starts getting involved, a rheumatologist comes into the picture. Similarly, if you look at diabetes, especially type 1 diabetes that everybody talks about, in itself is also an autoimmune condition. Thyroid related issue, that is hypothyroidism, is also an autoimmune condition, but when they are affecting individual organs like diabetes, hypothyroidism are usually dealt by endocrinologists, but when an autoimmune diseases affects multiple systems, it is dealt by a rheumatologist. So, among these autoimmune diseases which affect multiple systems, We could have autoimmune diseases that predominantly affect the joints, which are called arthritis, like we have rheumatoid arthritis, psoriatic arthritis, spondyloarthritis, which predominantly affect the joints but can affect other organs too. We have other autoimmune conditions which can affect multiple organs like the skin, joints, muscles. So, depending on it could affect the kidneys, lungs, heart. So, depending on which organ is getting affected, the kind of symptoms that they have. Autoimmune diseases have several names, like we have autoimmune diseases like systemic lupus erythematosus, which is commonly called lupus. Then we have something called Sjogren's, myositis, dermatomyositis, polymyositis, systemic sclerosis, and a lot of other autoimmune conditions can exist. There are also autoimmune conditions which specifically affect the vessels of the body, which could be small vessels, blood vessels of the body. So, that could be small blood vessels or the medium sized blood vessels or even large blood vessels including the heart, and these kind of autoimmune conditions are called vasculitis.
So you mean to say only when the condition gets complicated, where multiple organs are involved, that you get to see the patient?
It's not exactly like that. What happens most of the times is people do not give importance to these minor signs. So when they have a rash on the face, they would just neglect it or would take some local treatment, and by the time they actually reaches, probably other organs would get affected. So there's usually a huge delay in the diagnosis of systemic autoimmune diseases, but we would always feel that if a patient reaches us early, the treatment can be started at an earlier stage, which would give much better results rather than seeing the patient at a later stage when they have multiple organ involvement, and certain times when we do not treat it early, the organ could be damaged too.
So doctor, we've discussed about the risk factors for autoimmune conditions. So similarly, are there any triggering factors for this?
So as I mentioned, most of the autoimmune diseases are multifactorial, but once a person develops autoimmune disease, most of the times these diseases are there for long term. However, a person can have periods of remission and periods where they have flares. So periods of remission are basically periods where the disease is very silent, they do not have any major manifestations, the disease is under control with minimal medications. Periods of flare are when the disease shows up again. It could show up in the same organ with which it has started off, or it could show up in a different organ altogether. So there are certain factors because of which these flares can actually happen. So the triggers for flares are usually in conditions like lupus, it is basically sunlight. Second is infections. Every time a person has an infection, or if you logically think about it, infection triggers immunity, and the immunity is at fault. The immunity is attacking their own self. So an activated immune system could cause worsening of their autoimmune disease. Certain drugs can also worsen autoimmune diseases, especially drug default itself is a major trigger for autoimmune disease. So most of the times what happens is people who are having an autoimmune disease are under control with certain groups of medications, keep taking it for a longer term, and once they are fine, they'll not consult their rheumatologist or their physician, and they would just skip their medications because they are clinically totally fine. But what happens is this drug default itself is a big trigger for the autoimmune disease to come up again. Certain other triggers would be stress, especially in this particular era where stress is a part of everybody's life. A lot of mental, emotional stress or even excess physical strain can certain times cause worsen their autoimmune diseases. And hormonal imbalances, as I mentioned previously too, in males especially, we note that in conditions like ankylosing spondylitis, which is more common in males, and in rheumatoid arthritis, in males who have rheumatoid arthritis, we've noticed that smoking itself is a big risk factor for worsening of their disease.
So talking about medications, how do we generally treat these autoimmune conditions? Do we require any special kind of drugs therapy for this?
Our immunity is very important for us to protect us from infections that are coming from outside. But in these particular diseases, autoimmune diseases, since our own immunity is attacking our body, controlling the immunity or suppressing the immunity becomes necessary. Now, depending on which organ is involved, the kind of immunosuppressants or immunomodulators we give keep changing. The usual thought that a lot of people have is when we say immunosuppressants, all of them are steroids. That is what people think. So corticosteroids or steroids as it is usually called are also immunosuppressants which become a very important part of treatment of autoimmune diseases. They are both a friend and foe, that is what I would say as far as an autoimmune disease is concerned. They should be used judiciously at their right doses, and that could be life saving to certain patients. But when used unnecessarily at higher doses for people in whom it is not indicated, steroids can have their own side effects. There are a lot of other medications which are immunosuppressants or immunomodulators but are not steroids. They have their own side effects because you are basically suppressing the immunity. They will put the person at a slightly higher risk of infection compared to the normal individuals. But at the same time, whenever an immunosuppressant is given, it is given depending on which organ is involved, the benefit that the person would have on taking that particular immunosuppressant, which is weighed against the risk that they would have by suppressing their immunity.
So doctor, in general, is there any role of diet or physical exercise for these autoimmune conditions?
Lifestyle modification becomes a very important part of treating autoimmune diseases. The general thought that a lot of people have is when they are having a disease, suppose they are having an arthritis, they should rest their joints. They should not do any kind of exercise because the belief is the more they exercise, it is going to worsen. But that is not true. Except in conditions where there is severe pain and the person is not able to exercise, we usually recommend every patient of autoimmune disease to do 30 minutes of any kind of exercise on all days of the week. So coming to diet, there are a lot of myths that people have regarding dietary restrictions in autoimmune diseases, because most of these autoimmune diseases are called Vatam in Telugu. The moment we utter that word, they think that they should stop eating things like potatoes, tomatoes, brinjal, those which are more sour. I mean, anything that is sour should not be eaten. Then people stop eating non-vegetarian because they believe that increases the vatam in their body. So there are they stop dairy products. So there's a lot of false information about the kind of diet that patients with autoimmune diseases should take. The current scientific evidence suggests that people who have autoimmune diseases can take everything as long as their diet is healthy. So a balanced nutrition is what is important for them.
So before ending this episode, doctor, what message you would like to give to our audience out there?
So autoimmune diseases are conditions which are not recognized by a lot of people. Very few understand what autoimmunity is about, what a rheumatologist sees, and certain times it is difficult also to recognize an autoimmune condition because you would not know that this particular symptom or sign is suggestive of an autoimmune disease. So most of the times what happens is you land up with some other doctor who will recognize that this is an autoimmune condition and would reach us. But what is important is raising awareness among public about autoimmune diseases is important, because seeing the patient early and treating them early would prevent multiple organ involvement and also would prevent damage at several organs, and that is why recognizing these diseases at an early stage is very important.
So thank you, doctor. It was wonderful having you here on the program today.
Thank you.
So this brings us to the end of this episode. Hope this episode was informative on autoimmune disorders. Don't forget to join us for the next week as well. Until then, take care and stay healthy. Thank you.